everyone, my name is Dunn. I will be presenting to you a brief overview of my clinical process paper. I decided to write my paper on a group. The client system is a psychoeducation group that I facilitated with 5 adolescents ages 10 to 15. A psychoeducation group provides education to group members about mental illness and how to effectively cope with symptoms of various mental disorders. The group members are receiving intensive in-home services through Hope for the Future. The group began a few months ago to address challenges with interpersonal and social skills that the group members exhibited through observations from the intensive in-home counselors. The group members are diagnosed with mental disorders of post-traumatic stress disorder, conduct disorder, generalized anxiety disorder, oppositional defiant disorder, attention deficit hyperactivity disorder, major depressive disorder, and autism spectrum disorder. The group session takes place once every 2 weeks in the conference room in the agency building. In the session 2 of 20, I was discussing the purpose of the group sessions. The purpose of the group session is for each group member to freely express his or her questions, thoughts, feelings, and desires in a respectful manner. I made the statement regarding the purpose before we began the topic of our group discussion. There was a group member who made it plain and clear that he was going to keep his thoughts to himself. He stated, "I'm not telling my business to strangers because I don't need any group counseling. I can manage my own behaviors without attending a stupid group meeting." As a result, the group member attended the session but refused to talk during the group therapy session. I believe that it was problematic because it made me wonder if it was something that I said to him that made him feel uncomfortable or if the atmosphere wasn't set right for him. It could cause other group members to not open up about their thoughts in a respectful manner. The therapy approach that I will utilize is group therapy. Group therapy holds therapeutic value to address various challenges that various people face each and every day. Group therapy is just as therapeutic as individual therapy. It allows other people to learn from each other. For the problematic segment, group therapy would demonstrate to the members that his peers have similar challenges to him and that he's not the only one that is going through challenges at the time. Once he sees that his peers are transparent with the group, then he would gain the confidence and self-esteem to express his thoughts throughout the group. According to Dr. Yalom, group therapy would implement hope, education, common values, development of social coping and interpersonal skills, group cohesiveness, altruism, and interpersonal learning. Those factors, in my opinion, would address the problematic segment in an effective way. After the second session took place, I took some time to reflect on how I facilitated the group session. I believe that I should consistently be aware of the facilitative comments and questions that I make and how they would affect each group member. According to Wachell, a therapist must be aware of different factors that could cause a group member or group members to resist and to shut down. I must not be accusatory or critical to the group members, but engage in conversations that are appropriate and therapeutic. When utilizing group therapy, a therapist observes many different things that can make group sessions go in a positive way or to make them go into a negative way. When the group member stated that he's not going to talk at all during group because he feels that it is a waste of time, how should I approach the statement without being too pushy, critical, demanding, or interrogative? What can I do during group therapy that will make the atmosphere more comfortable for every group member to share his or her feelings, thoughts, and emotions in a respectful manner? What information can I present to the group to be transparent without too much self-disclosure?